From President Obama to Congress, top lawmakers say the United States healthcare system needs an overhaul.
75% of healthcare costs in the United States are attributable to chronic disease, and about 80% of that 75% is attributable to 4 chronic conditions and diseases.
And reports over America's lack of coverage is well stated, if not overstated.
Many don't even realize that their insurance policy doesn't cover what they need till they get to the hospital.
The World Health Organization ranks the United States 37th in the world for healthcare performance.
We even find now that people with insurance are self-rationing their care because they can't afford the copays and the deductibles.
Republicans say the costs are too high and would take away an individual's choice.
Why do you suppose it is that there is that travel from Canada to the United States?
Reformists say that's just not so.
Under single payer, you can pick any doctor, go to any hospital you want to. That's in contrast to our current system where the managed care organizations dictate which doctors are in their panel and which hospitals you can go to.
47 million people in the United States, including nearly 9 million children, have no health coverage at all. Many calling for reform say today's system discriminates against low-income Americans, citing that wealthy Americans receive $2,680 in tax breaks for health care, while the poorest Americans only receive $102. But healthcare reformists say what really disturbs them is the healthcare industry's ties to Wall Street.
We actually have for-profit insurance companies who have to respond to 2 masters. One is to the shareholders who own the company, and the other, of course, is to the patients that they're trying to serve.
The White House is working with Congress to create a universal health care system, one that covers all Americans and essentially decreases the power of private insurance companies. The president is asking the government, businesses, and consumers to all share the cost of the program, and he wants a bill on his desk by October. The program's costs are estimated to be about $50 to $60 billion a year. Do you think it's possible to get a bill on the president's desk by October, the deadline that he proposed?
I do. I genuinely do. I don't expect many votes on the other side, and that's okay. We didn't get any on the budget, but yeah, I think we can. I think we will do it. I think we have, but more importantly, we have to do it.
Questions over the healthcare debate unfolding in the months ahead are whether the current political landscape will prove more hospitable to mandates, cost controls, and tax increases. All measures now on the table that help doom previous healthcare reform proposals. For Press TV, Colin Campbell, Washington.